Indiana, let's listen in.
From the Fairbanks School of Public Health, Paul Halverson. Dr. Halverson is with us, and Neer is with us again. I've been looking forward to this day for quite some time.
We have too.
Good. This is, I'm really interested in hearing what you have to share. Before we do that, and then you'll make a more proper introduction of our guests, but you have some daily updates for us in terms of our resources and numbers.
Yep. Thank you, Governor Holcomb. Good afternoon, Hoosiers. Today we reported 409 additional cases of COVID-19 across the state of Indiana, which brings to our total 25,473 the number of Hoosiers that have been known to have COVID-19. That gives us a positivity rate of about 17% among the 154,083 patients or Hoosiers who have tested to date. We unfortunately also saw 38 additional confirmed deaths. To date, 1,482 Hoosiers have died of COVID-19, and another 137 are believed to have died from this disease based on their clinical diagnosis. As you can see, our percentage of available ICU beds and available ventilators remains stable. This week, we're sending a large amount of PPE out to our hospitals and our local health departments around the state. 128 hospitals and 90 local health departments will be receiving supplies. Hospitals are receiving more than 2.3 million pieces of personal protective equipment, including coveralls, masks, face shields, gloves, N95 respirators, and other equipment. Our local health departments are receiving another 1.3 million pieces of personal protective equipment for distribution to medical professionals, including our dental offices, primary care physicians, home health workers, dialysis centers and health clinics, EMS, and other public safety personnel. Indiana has also received 2 shipments of remdesivir, which is an antiviral medication to treat severely ill COVID patients. This first shipment went directly from FEMA to a hospital in northern Indiana that was considered to be a hotspot. And we've been working with that hospital system and their CMO to ensure that we are able to share this resource across the northern part of the state and the hospitals there that are experiencing the greatest need. The second shipment was sent to the Indiana State Department of Health and is being distributed to the hospitals with most severely ill patients. We've been notified by federal officials that Indiana will start receiving weekly allocations of remdesivir based on the information provided by hospitals about the number of COVID-19 positive patients they have in their facilities. We are very grateful to have this resource become available for Hoosiers because it has been shown in some cases to decrease the length of hospital stay. That's why we need Hoosiers to continue to take social distancing seriously and continue to use hand washing as a primary way of preventing the spread of this infection. Limiting your potential exposure is the best way that you can avoid needing this critical care. Today, I'm also pleased to report that more than 24 new sites are offering free COVID-19 testing and have gone live across our state. These sites have been added to our interactive map on our coronavirus.in.gov website. As of this morning, more than 170 testing sites are on our map located on this website. This list includes drive-through clinics, our statewide sites, those offered by healthcare systems and our local health departments and other entities. The testing criteria are listed on the site on the map. If you're coming to a state-sponsored testing site, I want to emphasize that there is no cost for these tests, and we want you to be tested if you have symptoms, if you live with someone who has symptoms, if you've been exposed to a positive case and need to get back to work, so we want to know that you're negative. If you're a high-risk individual, for instance, someone over the age of 65 or have diabetes, high blood pressure, chronic lung disease, if you are currently being treated for cancer and therefore are immune compromised, if you're a member of a minority population and at risk for severe illness, or you live with a high-risk individual, you do not need to be symptomatic if you fall into these categories, so please take advantage of this opportunity. And speaking of testing, I'm pleased that we're joined today again by Dean Paul Halverson and Neer Menachimi from the IU Fairbanks School of Public Health. As you know, we've partnered with the Fairbanks School on a research study to better determine how many Hoosiers who have had COVID-19 We stood up the first wave of testing at 70 sites around the state very quickly and were able to test almost 5,000 people in a very short period of time. I have to thank our Indiana State Department of Health team for being able to pull this together so quickly and to do it so well. The State Department of Health is not traditionally a direct provider of healthcare services, and this team has risen to the task time and time again throughout this pandemic and even before. I could not be more honored and blessed to be able to work with this amazing team every day. I also want to thank Fairbanks for all that they're doing to help us better understand the impact of COVID-19 in Indiana so that we can best direct our efforts and our resources. And with that, I'll turn it over to Dean Paul Halverson.
Thank you, Dr. Box, and thank you, Governor Holcomb. As Dr. Box mentioned, I'm Dr. Paul Halverson, the founding dean at the Indiana University Richard M. Fairbanks School of Public Health at IUPUI. Before we begin, I'd also like to thank a few people who have been really instrumental in launching this statewide effort. First, of course, I want to thank Governor Holcomb for his leadership and support in helping to make this scientific study possible. ISDH has been a very strong and close partner, and I'd like to thank Dr. Box for her leadership, as well as Dr. Lindsay Weaver's entire team working on this project. IU Health, Eli Lilly and Company, and Mackle have been terrific partners and have processed all of the tests on behalf of the state. The list of agencies and firms that have supported this effort is really long, but I'd also like to especially thank Scott Law and his team at Zotec Partners and Dr. Connor Norwood and his extensive data team here at the state. To all of the countless others involved in the logistics, testing, management, and coordination, we say thank you. I especially want to thank Reverends Moore and Green and Pastor Eddie for their invaluable help in recruiting people for our outreach study. But most of all, I want to thank all of the Hoosiers who have participated in Wave 1 of the study. Thank you for volunteering your time and providing us with your specimens for testing. Without you, this, of course, would not have been possible. Before my colleague Nir Menachemi shares the results of this study, I want to remind everyone how this study adds to our knowledge in the fight against the novel coronavirus. As we've previously mentioned, almost all of the tests conducted in Indiana and the U.S. have focused on patients with serious symptoms or other high-risk individuals, including frontline healthcare workers, essential employees, and people linked to locations that experienced an outbreak. What these tests do not tell us is how many Hoosiers might be infected. We know that COVID-19 can have many levels of severity. Some people have little or no symptoms at all the way up to very serious symptoms that require hospitalization. To continue to respond to and fight the spread of COVID-19, we need to continue on the good work that's been done to expand our testing, and it's wonderful to hear all of these new sites that are coming online. It's terrific. Ideally, we really would like to test every single Hoosier, but the next best thing to doing that is random sample testing, a scientific approach that allows us to confidently assess how COVID-19 has spread in Indiana without really having to test everyone, which is just not feasible. In our study, we sought to determine the proportion of Hoosiers that are infected, especially if they had little or no symptoms and would otherwise never get tested. In addition, we wanted to know what proportion of the state population may have previously been infected with the COVID-19 virus by testing their blood for antibodies. By knowing the proportion of Hoosiers currently infected and those previously infected, we gain significant new knowledge about how the virus has affected the entire population here in Indiana. I'm pleased now to introduce to you Dr. Nir Menachemi, who is leading this testing effort. Dr. Menachemi is the Fairbanks Endowed Chair of Public Health and leads our Department of Health Policy and Management. He's also a scientist at the Reagan Street Institute and has really been a great partner and a terrific leader in this effort. Nir?
Thank you, Dr. Halverson. Before I get into the details of our finding, I want to stress that our analyses are preliminary and that complex statistical analysis is still ongoing. while I don't anticipate wildly different conclusions, I do recognize that in the normal course of the scientific process, our results may be updated, especially as we get input from other experts through the peer-reviewed process, which may take several more weeks. As Dr. Box mentioned last week, we tested 4,600 Hoosiers, including more than 3,600 that were randomly selected and an additional 900 plus volunteers that participated in that targeted outreach done in conjunction with religious and civic leaders from African American and Hispanic communities. Now the results. We have determined that during the last week in April, 1.7% of participants were positive for the SARS-CoV-2 virus that causes COVID-19. An additional 1.1% were positive for antibodies at that time. Thus, we estimate that the general population prevalence of COVID-19 at the end of wave 1 was 2.8%. Because our random sample was purposefully designed to be generalized to the population, our data suggests that approximately 186,000 Hoosiers were currently or previously infected by late April. At the same time, the state was aware of only about 17,000 cumulative cases, not including deaths, suggesting that the true impact of the virus was almost 11 times greater than conventional testing had informed us. Stated another way, and shown on the slide with the iceberg on your screen, only about 1 out of every 11 true infections were identified by tests that were focused on symptomatic or high-risk people. Having reliable estimates of the number of people who have been infected also allows us to calculate much sought-after but otherwise unknown rates, like the infection fatality rate, which tells us the proportion of all those infected that have died, as opposed to the case fatality rate that focuses mostly on those conventionally tested. While both sets of information are important to know, we have now calculated the infection fatality rate in Indiana to be 0.58%. We determined this number by dividing the number of people in Indiana who have died, which by late April was about 1,080 people, by the sum of the total infection and deaths, that is 186,000 plus 1,080. We also found that 44.8% of those that tested positive for active viral infections reported no symptoms. This was already suspected by experts, but never precisely determined until now. We further found that participants who reported living with a person in their household that was COVID-19 positive were significantly more likely, in fact 12 times more likely, to be positive themselves. This finding, along with the relatively low 2.8% prevalence, strongly suggests that our social distancing policies played a critical role in curbing the spread of the virus and containing it to within households as opposed to within the community. The good news is that by slowing the spread of the virus, we now have bought some time to determine the best way forward. However, it's important to stress that the vast majority of people in Indiana have not been infected and represent the minimum pool of still susceptible individuals. Therefore, as we slowly phase back and reopen the economy, we need to be extra vigilant with any and all safety precautions so that we do not lose the ground that we gained by hunkering down. Another important finding of our work is that some communities in our state have been more greatly affected by COVID-19 than others. Our analysis from the random sample suggested that non-whites and Hispanics have higher positive rates. This was confirmed with the data from the targeted outreach that allowed us to gain additional participants from these communities, further strengthening the evidence in support of this disparity. We are committed to continuing our work with leaders of these communities to figure out how to contain the spread of the virus in the areas most affected. We also found some differences across public health preparedness districts, as depicted in this graphic. District 9, which experienced an early facility-based outbreak, was observed to have the highest general population prevalence. District 5 and District 1 were also slightly higher than the other districts. I want to also echo Dr. Halverson's comments and personally thank all of the individuals, the Hoosiers, that willingly and patiently participated in Wave 1. Their contributions have provided Indiana, in fact the country, with extremely valuable new information. The IU Fairbanks team and ISDH, along with the partner agencies and firms, are actively planning Wave 2, which is tentatively scheduled for June 3rd to the 7th. For Wave 2, we will start all over again with randomly selecting new people to participate and developing outreach programs to underrepresented groups as appropriate. Wave 2 data, compared to Wave 1 data, will allow us to determine how much further the virus has spread in our state at that time. This information will provide further evidence on how to best assure the safety of all Hoosiers. As such, I would like to stress in closing that it is extremely important for a maximum number of randomly selected individuals to participate in the upcoming waves of testing. There is no other way to easily assure that the experiences of all people are represented in these consequential inputs that influence the policy decisions that affect us all. If you get an invitation, please make it a priority to participate. Thank you.
Thank you so much, Mayor. I know this was just a snapshot in time, but the data is absolutely fascinating to me. And this is data that we can use as we go forward, and we use those guiding principles for how we're going to gradually and slowly reopen the state of Indiana to make sure that we do this in the most safe fashion. It very much underscores what we have been saying in the past. We are going to continue, based on this data, of course, our outreach, especially as we target our specific drive-through sites to those minority populations. Already, almost 45% of our drive-throughs have been done in minority communities, but it further emphasizes the need that we need to make sure we are there so that they have easy access to that type of testing. I'm just very, very grateful for your partnership and very excited to be a part of this. We'll look forward to the next phase, and as I mentioned to Nir earlier, it'll be interesting and exciting to see if those antibody numbers go up quite a bit. Thank you.
All right, Rachel, you want to jump right into the Q&A?
Adam Van Oostel, Hannah News.
Good afternoon, Adam.
Good morning. Good afternoon. Thank you. I wanted to ask, is Indiana still having any difficulty obtaining reagents or testing supplies, and what you might be doing to solve that problem? Thank you.
It's an excellent question. And yes, there are still some difficulties in accessing that. We have had more regular shipments, but still in limited amounts, and that includes our cassettes as we do our point of care testing. So we are really looking to see if we can't, as a state, kind of bulk buy these things and investigating how we might be able to be a better customer out there so we'll have easier access.
Meredith, WLFI.
Good afternoon, Meredith.
Good afternoon. How are you guys doing?
Good, thank you. Yourself?
Not too bad. So my question is mostly for Dr. Box, but Governor, feel free to weigh in. So I had a viewer call me with concern that Cass County commissioners have chosen to only stay in stage 2 for 1 week, which according to the executive order, they're supposed to stay for 2 weeks. So I wasn't able to get a hold of them to see if this was true. This is what someone told me. But if that is the case, what sort of health risks does this, make for anyone in that county? And is there any action that the governor would take if they don't stay in this stage 2 for 2 weeks?
So I'll let the governor answer about what action he would take on that. I'm not familiar that is the case. I would say that the concern that I had about Cass County, it's been over 2 weeks now since we had those very high numbers in the Tyson plant up there. Most of those were younger individuals. The average age, I believe, was around 40. So it's not that I'm not concerned, but I was less concerned than I am about an outbreak in a long-term care facility, for instance. So I really think that they have at this point seen their peak. But we do want to continue to open things on a slow and steady gradual timeline.
Yeah, I just, Meredith, I'd repeat all of that, but to say that this roadmap is just that, and it goes through July 4th. It will not stop at July 4th. We'll have updates along the way. and we'll have tweaks along the way to our executive orders, potentially even before we get to stage 3. But as Dr. Box said, for Cass County and others who have decided to be more stringent, whether it was us or local decisions to be more stringent that we support, we had this in a staged process for a reason, because we didn't want to just all rush in as you were catching up. And so we'll assess along the way where we are every day, but this will require us to, and we are, reaching out to the Cass County commissioners and our health departments. The state and the local health department will work together to make sure that not just Cass County, but 91 other counties, if they find themselves in a similar situation, that we are all on the same page.
Eric Berman, WIBC.
Afternoon, Eric.
Afternoon, Governor. Hello, Dr. Box. Question for Dr. Box. You've talked previously about how, as we've moved past the peak of this pandemic, that the hospitals have been withdrawing from their surge capacity and there have been less beds assigned to intensive care. The dashboard shows that we've added back 160 intensive care beds the last 2 days. And my question is, do you know where in the state that is being done? And does that give you concern that we're headed into a second surge?
We look at that data on a regular basis, but I don't know exactly where those beds have been added back in. We would have to look back at that. But again, we are looking at the number of COVID patients that are hospitalized each day through our EM resource data.
Angelica Robinson, Wayne TV.
Good afternoon, Angelica.
Hi there, can you hear me?
Yes, ma'am.
My question is with regards to phase 2 of your executive order. I understand that as a part of that, gas stations and other places should not allow self-serve stations like fountain drinks, pop machines, the coffee stations. My question is, why now for that, given that, the last couple of months they've been able to do that, and how will that be enforced?
Well, you can use the self-service station now, and you will be in the future. We're working with the Food and Fuel Association. I see, Cindy, you have taken to the podium, so you're about to clean up something on aisle 1 that I say here. But you want to take it from there as your discussions evolve to clarify, because I've heard this too.
Absolutely. Cindy Carrasco, Deputy General Counsel to the Governor. And Governor, you're absolutely right. They can do that now. Obviously, things are changing, right? We're moving on in the stages of businesses that can be open, so people are going to be circulating a little bit more. So we have been in touch with the association. We'll be working to develop some sanitary guidelines for how these stations should be handled, and we should be good.
Kayla Sullivan, Fox 59.
Good afternoon, Kayla.
Good afternoon, Governor. I have 2 questions. So the first is asking if you'll extend the shut-off moratorium indefinitely until a task force determines the hardship COVID-19 has had on utility companies and ratepayers. This is something that's being suggested by the Citizens Action Coalition. And then my second question would be for the Fairfield Group. I want to know if there are any percentages of false positives and how accurate those conclusions might be. I know some firefighters have told me that they're being asked to have 2 false tests before they come back to work, kind of indicating that their concern is the accuracy of the tests.
Yeah, I'll answer the first one very quickly. We very well might. We could. We're not there yet, but as we update our executive orders, we contemplate all of the delays we've already put into place across the board. So this could fit into that category.
Yeah, so thank you for the question. We're always concerned about the accuracies of tests. And after talking with some of the experts on the team that run the tests and understand the ramifications, we believe that the current tests, including the ones that we have used, are unlikely to have a lot of false positives. There is a slight chance, or a greater chance, but still a slight one, of false negatives. But remember, our testing was done at the population level, not the clinical level. When you're testing someone clinically, both false positives and false negatives have, consequences to what ends up happening that are not positive. When you're testing at the population level, if false positives are not as big of a concern, false negatives are of a concern, but would only downgrade our prevalence estimates. And we're now in the process of doing some statistical analysis to determine how much the margin of errors around the data that we've just presented, how much are the margins of errors around that. I don't think they're going to be huge, but because of the point that false negatives are possible, we are in the process of calculating that.
Sheila, WLKI.
Good afternoon, Sheila.
Good afternoon, Governor. We have a beautiful day here in Northeast Indiana.
We are all blessed.
Yes, we are. Hey, as you have discussed in previous briefings, Hoosiers are experiencing different degrees of anxiety and stress with a number of issues related to COVID-19, everything from economic issues to stresses with childcare and educating at home.
Yeah.
You and your team have encouraged Hoosiers to be mindful of mental health issues. I'm curious, how are you and your team of state leaders dealing with it yourselves? And what kind of things are you finding helpful to decompress at the end of your workday and alleviate stress?
You're going to take me to a sentimental place, so I will pitch it over to Dr. Box to answer first.
That's an excellent question, actually, and I just had the discussion with Dr. Weaver before I walked over here, and that is, right now, as opposed to a lot of Hoosiers that are sitting home and kind of really needing to get out and needing something to do, we are so busy every minute of every day that the hard times for me are driving to work and home from work. That's when I actually have a moment to kind of wind down, because as soon as I get home, I'm right back working again. But we actually reached out through Dr. Sullivan at FSSA and her Division of Mental Health and Addiction, and we actually had someone reach out to us and come over and talk to our team and be available, make sure that everybody has resources and names and numbers that they can call, because I think that's really important. I think right now everybody is working so fast and so furious that it'll kind of come afterwards when and if this ever lets up. So we have recognized that as an issue. For me, it's normally exercising on a regular basis, which I hate to say I have not been doing regularly. So I'm hoping to get back to that soon.
Yeah, I'll confess, me too. And that's a stretch for me to say get back to. I wasn't exactly the example going into this. But I will say that, and I mentioned this to someone else earlier today, Sheila, that we have each other, and we are surrounded by, I think, women and men who have the head and the heart for this mission, that have risen to not just the challenge, but to meet every moment of the day, and we're doing it together. And I think speaking for some others, we are fueled by the inspirational actions and investments and sacrifices that people are making all over the state, all over the country, all over the world. And we're learning along the way. Anyone that says they got this thing figured out before they went into it, I would suggest is misleading you. It's novel by definition, and who knows where this will be in a year, but I am comforted by the fact that we have a good team in place that goes from the very local level, from the home, people stitching masks for those in need of them, all the way to our federal partners in Washington, D.C. We are all kind of moving in the same direction, and I can tell you that for me, just on a personal level, I take a daily walk with my dog every night. The dog is a lot more lenient with my schedule, and it's usually just before midnight.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Can you folks hear me just fine?
We can always hear you just fine. You don't need a microphone.
No problem, sir. Two good questions. One of which, the data that you folks heard from Fairbanks, what does that tell you about how Indiana has progressed so far with kind of reopening, getting back together? And secondly, this may be for Fred Payne if he's there. For Hoosiers that cannot go back to work or don't think they can go back to work because they may have a comorbidity, what's being done for them? Do they lose their unemployment, or what happens?
How about Fred, if you go first, and then Neer and Paul, if you'd back clean up.
Sure. With regard to return to work for Hoosiers, we are still looking at those on a case-by-case basis. We're looking at them on an individualized basis because each case is so fact-intensive. So we want to make sure that we're doing everything that we can to promote good hygiene, good health, and good support from our employer community. The employers, again, that I've spoken to are doing everything that they can to make sure that they have a workplace that has taken into account all of the steps necessary that's laid out on the Back on Track plan. So again, we are looking at those on a case-by-case basis.
So the question about reopening is obviously an important one. And I'd add that there's no single data point that can or really should drive that decision. It's a much more complex issue than just, the data that we presented today. I also know, and I don't think this will be debated, but staying closed indefinitely is not an option either. And so I like to think about or put the focus on the what we should do when we reopen. And I would characterize the what with the word vigilance. All safeguards, all public health measures need to be double and tripled up. That includes the masks, the distancing, the no large gatherings, anyone who can work from home should be able to, accommodating people who are high risk in the workplace, the hand hygiene, the needs to minimize the risk of infection and spread will probably not go away until we have a vaccine or a really good treatment that can deal with everyone infected. And so that's going to be true regardless of when we open. I'd like to see a lot of more focus on the what.
And I would just say, to supplement that comment, is I think a couple of things come clear to me. One is that with an estimate of well over 100,000 Hoosiers that are affected by this disease, either currently or previously, it answers the question about the idea that this is a problem that somebody else has. The reality is this is a problem that a lot of people have. That nearly 140,000 people that have been affected are really, again, it's the tip of the iceberg as we begin to look at this. And when we see that the vast majority of people in Indiana have not experienced this disease, and again, without a vaccine, it tells me that we have to continue to be extremely vigilant with our social distancing. One of the things that I've said from a public health perspective from the beginning is that we probably need to assume that we have the virus and that everyone else around us does as well, and act accordingly. And I think that sort of advice would go well for all of us to follow, especially when we recognize that there is so many people in our state that could be affected that haven't been yet. So it is a very infectious disease, and we need to pay a lot of attention to it.
Yeah, and Dr. Box, if I could, because I know you're leaning into the question, I think you both make very important points about we're in this for the long haul. And it is the what or the how we reopen. It's critically important. Every action has a equal or greater reaction. Right. Our habits and our behavior, how we're physically distancing and socially distancing, and our hygiene. But the vigilance part of it, it's everyone's responsibility. Whether it's the consumer confidence will go up when they see this new reality. Right. It's not just a new normal, it's a new reality that we'll find ourselves in. And how we conduct our affairs in that new reality, driven by the data that tells us where that road's leading to, that's how we'll make our decisions.
I think you guys have said it all, but the one thing that I want to reiterate is what Dean Halverson just said, and that is we should all conduct ourselves like we are infected. And it's been a little heartbreaking for me to see some of the pictures that people have been sending in where people are standing in line back to back next to each other. They're not social distancing, and people are not wearing masks. And if I could turn the camera around and show you everyone in this room right now, everyone has their masks on. And I think when you're inside, when you're in a retail establishment, please wear your mask so that just in case you are one of those 45% of people that are asymptomatic positive. Of all the positives we had, 45% of people said they had no symptoms at the time they were tested. That should underscore the importance of why you need to wear that mask and social distance.
Go ahead.
I was just going to say, Governor, and especially given the fact that we know scientifically that people are most infectious right before they become symptomatic. And so that tells me that we can't take anything for granted. We really need to be cautious. I'm sorry.
And no, I mean, long haul, in it for the long haul. We were hunkered down, it paid off, and now we're in a stage where we have to continue to be mindful, understanding that vaccine or that treatment is down the road, long haul. We're not going to wait for herd immunity. Long haul, way down the road. We got a long way to go. If I walked away from this study with anything in my head, this is a long road ahead.
Yeah.
And we can't. What we have to do, and this is what we're doing, is we have to be able to manage our way on this journey and manage the crisis before us. And it starts with our health. If that erodes, so does the economy, so does our workforce, so does everything else. So we're in a good spot right now because we have been vigilant.
Right.
And this ought to reinforce that what you've done to date is working. But what we don't want to do is say, there, we're done. We're in a good spot. We can't retreat back to, well, we will if we have to, but I don't want us to have to retreat back to a prior stage.
Justin Keel, the Westville Indicator.
Good afternoon, Justin.
Good afternoon, Governor. One of the earlier slides showed the prevalence rate by district. That map showed a rate of 0% for District 2, which is the South Bend and neighboring areas.
Yeah.
Can you elaborate on how this prevalence rate is possible for that area?
Yeah, sure. Thank you. So remember, what we did was randomly select people from within districts and then go out and test them. And I don't recall the exact amount, but there was some 250, 300 people that were randomly selected from that district, and all of them came back negative for both active virus and antibodies. And so that's how we derived the population prevalence rate to be 0. That doesn't mean there's no one there. There might be people in hospitals, there might be people through conventional testing approaches that are found. It's just that the people we tested through our approach, none came back positive.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. I've got a couple of questions related to the Fairbanks study. It seems like, is there any sort of population breakdown on who was tested based on race or gender? Secondly, it seems like we tested less than we aimed for. We tested 4,611 and you aimed for 5,000. And phase 2 is pushed back from the previous announcement a week. I was just wondering if there was a reason for that. And then for Dr. Box and Governor Holcomb, I was wondering if, based on these results, we had any policy changes. This is meant to inform and guide you. Are you changing anything, or is this just adding to what we already know?
So I'll take all the questions about the sampling and the breakdown. So we do have the breakdown by race and gender. We can provide those. It's important to note also, given the type of study that this is, what we end up doing is get people respond. And if we have folks that were invited but didn't respond at the proportions that we would have hoped for, we're able to scientifically rebalance the results of the people that did respond to represent the people like them that did not. And so the results that I presented to you had been generalized to the state of Indiana population. And providing you with the actual breakdown of the respondents, which again we can do, I think is less important in terms of determining how to interpret the data. Now you mentioned the 5,000. Before we started this, we absolutely aimed for 5,000, and we did so based on a conservative estimate of the number of people we're going to need, given an unknown prevalence, to have a precision of, plus or minus 1 percentage point around the margin of error. And so we knew that, 5,000 was always the goal. And had the prevalence been much lower than it was, we might have needed more people to have the precision that we feel like we have. But we feel comfortable that with a high level of precision, that the data that we represented is true for the population. And then the reason we pushed back the phase 2 was twofold. Number one, we were shooting for the end of May, and I think the team determined that during the holiday weekend would not be the ideal time to get maximum participation. And secondly, we also wanted a couple of extra weeks to go by after the reopening, the slow reopening, so that we'd get something meaningful to detect. For example, if we just tested everyone today when, everything is still pretty much hunkered down, we wouldn't expect to see that much of a change. And so within the first 2 or 3 weeks after that, we'll get the first glimpse of how the, relaxing of some of the issues have impacted the population.
In regards to how this might change our policies going forward, again, this is one piece of data or one group of data in relationship to all the other data pieces that we're looking at. So although it will guide our policies, I can't tell you specifically right now what it will do. I can tell you that from my perspective, it has underscored the importance of making sure that we have testing accessible and available to our highest risk minority populations. And so we will continue to focus on that as we already have. And I think it will also underscore when we look at the fact that if you were living with someone who had tested positive for COVID-19, you were 12 times more likely to get it. It really underscored the fact that our social distancing measures were really working. And that, along with wearing masks, especially when we're inside retail facilities and other places, I really think that that would be a policy thing that I hope that some of our businesses take to heart, and some of our retail establishments, to say, we are showing that our social distancing policies and wearing masks makes a difference. Whereas before in the United States, we never really had this kind of look at this. We didn't know what those social distancing things were going to do exactly. We thought they were going to make the impact that they did, and we've shown that. But realistically now we truly have the data to show that, and I want to emphasize that as we go forward.
Yeah, I would say that I wrote down the word underscores as well, and you said it 3 times, and it underscores some of our suspicions or predictions about where we thought we were. A lot more people were infected than we knew of the cases. We always suspected that. But to your point, this underscores the absolute necessity that folks operate in this new reality going forward. Otherwise, we'll see different results. And because the virus, this novel coronavirus, is still out there, and it is roaming the hills and hollers throughout the state of Indiana, and it's not just in our dense population areas, it's all over, all counties. And what this tells me is your 186,000 that you cited or predicted, the prevalence, that tells me this, understanding that figure out there, and what did that do to our healthcare system and our resources. And so going forward, now we're equipped with more knowledge, and we'll just keep adding to that as each of your waves come online. Rachel.
Jackie Ryan, the Stark County Leader.
Hello, Jackie. Good afternoon.
Good afternoon. And first, I just want to thank your special guests for providing that informative snapshot today. Definitely appreciate that. And now on to my questions. I just have many people who have been commenting about how they would appreciate seeing recoveries reported alongside the number of new cases and the running total. Could you explain why that information may not be as readily available? And on a related note, when is a positive patient considered recovered, and would they need a follow-up test to confirm that they've reached that point? Thank you.
Thanks, Jackie.
Let me take that. You can add whatever you feel you need to. So from when is a positive patient recovered, the CDC has a couple of different ways that we can gauge that. Number one, you need to be at least 7 days from the onset of your symptoms, and an additional, and actually they say 10 days now from the onset of your symptoms, and an additional 72 hours for sure from any of your symptoms. And that means no fever. You can't be using aspirin or Motrin or Tylenol to bring that down. The other way to do that is to require 2 negative swabs or tests done, PCR tests, within 24 hours of each other. That is a little more cumbersome and difficult, and sometimes we find people many days, 21, 30 days out, that are still showing positive, but if we were actually culturing those people, we were not finding actively replicating virus. So we did not believe that they were infectious at that time. So most people have gone to more the clinical diagnosis, and that's when we consider you recovered. I kind of forgot the first part of your question.
Should we, or when would we, or how will we release recovery data?
Oh, so we have released that. When I gave the hospitalized data, I think that the first wave of data we gave you was 80% of individuals were recovered and 14% were known to have died. The rest were assumed to be in the hospital. And I think the last data was 70% and 16% unfortunately had died. So we do give that based on hospitalizations. I think that this test is actually, the study specifically tells us that many people out there have recovered from this, but we never even knew that they were sick. So Nir, do you want to comment on that?
That was exactly what I was going to say. So in our study, we said 1.1% had presence of antibodies in their blood. That suggests they've recovered, but many of them may have been asymptomatic in the first place. And so really what it's telling us is that 1.1% of people's bodies mounted an immune response to the virus. And so the word recovered is more clinical, and I think Dr. Box covered it. When we're talking about it in the population, the number of people who have been infected and are now beyond that infection was that 1.1% that we mentioned earlier.
It's also one of the important reasons why this study is actually important baseline population level, right? Because we want to see that number of people with antibodies increase over time, and that will give you some degree of confidence that we're progressing through this disease. So.
You might talk a little bit about the death rate, Nir, too, the case death rate versus the death rate that we saw based on infections.
Yeah, thank you. So up until now, every time, anywhere really, whether it was in Indiana or the U.S. overall, we kept on hearing about case fatality rates. It's the number of people who die who have tested positive, but again, through conventional testing that has focused mostly on the sickest and high-risk patients. And so that number has fluctuated between somewhere 3 to 5%, I think, depending on who you asked and under what circumstances. But it has always been missing that denominator. The important question also is not only how many people who have tested positive die, but how many people who are infected die. And the numbers that we presented today was 0.58%. I'm doing the math in my mind real quickly. It's somewhere in the neighborhood of about 1 in 180 people who are infected die, which is a lot less worrisome than the numbers we had before, but is not a necessarily we're scot-free number. This, for example, is significantly deadlier, almost 6 times deadlier than seasonal flu, and it's asymptomatic and more infectious. And so if you want to sort of use that as a comparison, the infection fatality rate, which we now know, is still really an important piece of data that the governor keeps saying, is important to have, and we agree.
And Jackie, we'll have you an update on Friday. We'll make sure that we insert this piece of data Friday.
Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon. Thank you all for being here. I have a question for the Fairbanks researchers as to whether you looked at those 45% that were asymptomatic that had basically tested positive were there any demographics, age specifically, were there any specific demographics that kept on cropping up with them? And then my other question is, not to be too querulous, but we're kind of saying what we did was pretend as though everyone is either infected or could be infected, but yet if we're infected, what we're supposed to do is stay home and not see anyone. So there's kind of a dance between, what this high rate of asymptomatic means. I mean, should we all, even if we're not experiencing symptoms, if we're not in some of those risk groups that Dr. Box mentioned, should we be thinking about whether, as testing becomes more available, we should kind of be randomly testing ourselves to make sure we're not in that 45% of asymptomatic and inadvertently going around and spreading the disease?
So I'll take the first part of the question. So we have not yet looked at the question that you posed about the demographics of the 45% asymptomatic. As you can imagine, there's so many data points that we're still pouring through, and we want to make sure that when we report something, we're as confident in it as we can be at the time that we report it. And so it is on our to-do list to look at those kinds of questions and many more. Before I let Dr. Halverson maybe mention about the pretending everyone is infected, let me just make a comment about randomly testing ourselves doesn't make as much sense as randomly testing from the population. Again, I think this is the important distinction between clinical testing and population level testing, that testing oneself cannot substitute for population level testing. And so there's nuances there with both sets of information, clinical and population, being vitally important in the war against the virus.
So as it relates in particular to the sort of recommendation to act as if you're positive and everyone else is as well, there's also the reality that unless you actually have symptoms, the life does go on. As the governor's mentioned, we have to get back to some degree of normalcy. So we do know that social distancing works. And so I guess in part my recommendation was to really focus on taking social distancing seriously. It's not just when you feel like wearing a mask, or it's not just staying away or creating distance when it's convenient, but it's doing it every time, all the time, with the idea that you need to protect yourself and you need to protect others. And in particular, that's what the mask is for, is to protect others. But I would say especially for people that are in the over age 60 group, or people who have immunocompromised immune systems or other chronic diseases that make them more likely to have complications from this disease, we really need to take seriously the idea, if you can work from home, you should. And if you are able to avoid making unnecessary trips, and certainly you wouldn't want to go out into large groups, frankly, that just increases the odds that you will actually contract this, or more importantly, perhaps from a population perspective, that you would contribute the disease to someone else. Unwittingly, unknowingly, these large group environments, for example, are something that we can and should avoid, and that's really the nature of the advice. We have to figure out ways in which to live long-term in this new environment.
I think you say it exactly, Dr. Halverson. This is not going to change in a month or 2 months, right? It is going to be until we have that vaccine out there or that medication that we know can really knock this down. So until that time, we have to reopen, gradually get back to the new normal lives we're going to have, but as you say, protect those high-risk individuals. And what we have to understand is that we right now are going into a more dangerous phase, because those of my family members that have been coming over and seeing me have all been working from home. You know, my little grandson's been not going to daycare and other things, and now all of a sudden they will be out more in the public. So it is very important that especially we wear those masks and we social distance.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Hello, Governor. I have 2 quick questions. One is regarding the 45% asymptomatic that the study found. I'm wondering, when will we be able to get anyone tested, regardless of symptoms or high risk, that kind of thing? And also, secondly, specifically for Governor, do you support Dr. McCormick's decision to allocate the CARES Act money under the Title I formula?
First question, you might want to, or second question, we are reaching out to Dr. McCormick today, and I look forward to talking with her about her preference and her statement that she made yesterday. This has been the case in the past. I want to make sure I have the full picture before weighing in on that policy. you want to talk about?
Well, we are increasing our testing significantly around the state, and we have definitely opened up those individuals that can be tested. Many asymptomatic individuals would qualify for that, which includes individuals that are our first responders and individuals that work in long-term care facilities. In fact, one big push that we're working with long-term care facilities right now is to make sure that all the employees are tested. And as we go further and further, we're not going to get it done in the next 2 weeks, as maybe the White House would like us to, but we will expand our testing to test individuals in our long-term care facilities, all of them. Realistically, I think what people need to remember is that it is a snapshot in time. And just because you get tested and you're negative today does not mean that 6 hours, 8 hours, or 24 hours from now that you may be positive. And I fear a little bit that result that will bring out in you that, oh, hey, I'm negative, I'm good until what? Next week or 2 days from now, whenever you get retested. So there is a concern about that concept of testing everybody over and over again, or even just one snapshot in time, and then having that security to know that you are not infected and that you actually could be.
You know, the capacity to test throughout the state of Indiana, Nikki, is, from our perspective, has always been driven. How can we ease people's minds who are at risk or high risk, as you said, but even at risk, go in and get tested. We have the ability to test you. You see our numbers, those test numbers go from 4,200 to 4,300 to 5,500 to 6,400 to 4,600. We have the ability to test you, and now as we stand up, you mentioned 170 different locations. Don't take your healthcare physician out of the equation. If you have symptoms, you need to be talking to your healthcare provider. And they can guide you as they would with the flu or with a broken arm or anything else to seek proper medical attention. But Dr. Box brings up the point. The question is not, do you test every Hoosier? It's really, then you go down the road of how many times do you test every Hoosier? Because if you get that negative back today, we know this is going to be with us for the foreseeable future, which goes into 2021. And by the way, it could be a second wave coming back in the fall. And so testing every Hoosier is a one thought, but we've got to test the folks who are at risk, front lines, been around, high risk, et cetera. And we can do that right now. Yeah, context.
And I think each of our Optum sites has the ability to test almost 140 individuals a day, and we're going to have 50 of those sites plus all the additional sites, so 120 of other sites. And that will just continue to be more available. With the new saliva test that you can actually eventually get mailed to your home, you can spit in a tube and send it in and get tested. So testing is going to be much more widespread than it has been in the last 8 weeks.
Putting on my former health officer hat, let me compliment you, because this really is a multi-pronged approach, and you are expanding testing greatly, including people that find themselves in those high-risk categories, which is wonderful, even if they are asymptomatic, which is terrific. And then secondly, again, let me just underscore how important it is to have that capacity to move quickly when there is an outbreak, and do the contact tracing so aggressively. That we have to move on all fronts, and you're doing that, and that's so important to our state.
Yeah, and we're seeing real case studies of this, whether it be in Logansport at a meatpacking plant, or move around the state, nursing home, et cetera. The ability to be able to meet one surge with another surge of resources is critically important going forward.
Thank you for joining today's briefing, Governor Holcomb.
All right, you've been listening to Governor Eric Holcomb and state officials updating us once again on the COVID-19 outbreak here in our state, including the results of an antibody test. We'll have much more on that test and the numbers that came out today coming up at 5 and 6. Mike and Anessa will be back with you in about a half an hour for All Indiana.